All right. Good evening, everyone. My name is Elena Statue, and I am the curator of the Global Shapers Cleveland Hub. And just briefly, Global Shapers is an initiative of the World Economic Forum. So we're a young professional organization organized across cities all throughout the world, focused on local social impact. And if you've been following us over the last few months, we have been partnering with Black environmental leaders and Freshwater Cleveland to do an environmental justice media series, which involves doing a webinar such as this one on a particular topic, discussing with experts in the area, followed up by an article written by Freshwater Cleveland. So today I am joined by my fellow Cleveland Hub member and impact officer for our hub, Moses Nagong, who will be facilitating the discussion. So I will let Moses take it away and introduce our panelists.
Hey, good evening, everyone. So excited for you all to be joining us. As Elena just said, my name is Moses Ngong. I am the Impact Officer for the Cleveland Hub of the Global Shapers. I live here in Cleveland. I'm a transplant, but I very quickly have come to love the city and call it home. I have a good amount of experience in the environmental field myself. I studied environmental studies in college, was an environmental education volunteer with the Peace Corps, and then worked briefly for a think tank in DC and helped push environmental initiatives there. But I'm so excited to learn more about our topic tonight from our incredible panelists. So I'm going to go one by one with the panelists, having them introduce themselves, a little bit about their background. So if we could start with Almeda Cooper from Moms Clean Air Force, if you wouldn't mind introducing yourself for our audience.
Absolutely. Good evening, everyone. I'm Almeda Cooper. I'm with Moms Clean Air Force. I'm the National Manager for Health Equity. I've been with Moms for about 2 years, and I'm currently based in Washington, D.C. However, I have deep ties to Ohio. I lived in Ohio longer than I've lived any place in my entire life, which was about 15 years. And while I was there, I was the chief legal officer for the Ohio State University Wexner Medical Center, and also general counsel at Ohio State Medical Association. So in the first part of my career, and the last 30 years of my first part of my career, I was a general counsel in various healthcare organizations. And over the last 2 years, I've been at Moms Clean Air Force. And we are a national organization of about 1.5 million moms, dads, and caregivers. We focus on clean air and protecting children's health. There are about 88,000 members of Moms Clean Air Force in Ohio. And we cover a variety of issues that are related to children's health and clean air. We have been particularly active with electric school buses, with clean air, just in general issues, been involved with regulatory issues. We work to encourage moms, dads, and caregivers to get involved with their elected officials at the local, state, and federal level. And I'm sure as in our course of our conversation, I'll have a chance to talk more about what we do, but I think that's a good opener.
Thanks so much, Almeda. Christina, if you wouldn't mind going next.
Sure. Good afternoon, everyone, or evening now. Thank you for joining us in this conversation, and thanks to Cleveland Global Shapers for having me today. So I am the Chief of Air Pollution Outreach for the Cleveland Department of Public Health, the Division of Air Quality. I have been here for about 5 years now, going on that in February. And my role is anything that relates to public health, air quality, and community engagement. So there's quite a few overlaps in those topic areas. So anything that comes into that realm is what I manage. Prior to working with the Cleveland Division of Air Quality, I worked at an environmental nonprofit organization for about 8 years. The last few years that I was there, I managed a transportation program that looked at reducing emissions from the transportation sector. And then I also did some special event and marketing work when I first started at that organization. Currently at the Cleveland Division of Air Quality, we are the contracted agency with Ohio EPA that is responsible for enforcing all of the rules of the Clean Air Act and our state of Ohio air pollution rules for Cuyahoga County. So we do that through our enforcement staff that conduct facility inspections and respond to citizen complaints. We operate an ambient air monitoring network throughout Cuyahoga County that monitors for particulate matter and ozone and the other criteria air pollutants. And then we also have a permitting staff who are responsible for receiving permit recommendations from facilities that may require an air permit and writing up those recommendations and submitting them to Ohio EPA. So thank you.
Incredible, thank you. And last, Tim Kovac from NOACA, if you wouldn't mind introducing yourself.
Sure. Thanks for the opportunity. Tim Kovac. I'm an air quality planner with NOACA, the Northeast Ohio Area-Wide Coordinating Agency. NOACA is the federally designated metropolitan planning organization for the 5-county Greater Cleveland metro area. So what that means is we are responsible for conducting transportation and environmental planning activities in the region. We also are able to distribute about $50 million in federal funding for transportation and environmental improvements and infrastructure investments each year. We have transportation planners, water quality planners, and then I'm our air quality program. Prior to coming to NOACA, I've been with NOACA since 2015. Prior to NOACA, I worked on the 2014 Gay Games that was held in Cleveland and Akron. I actually created the first sustainability plan in the 32-year history of that event, and that has been continued in the subsequent two game cycles in 2018 and 2022. And I have a master's in global environmental policy from American University, but I am a Cleveland native. In my position at NOACA, I have a number of responsibilities that touch on air quality and transportation. So I track changes in air quality in the region and publish an annual report on air quality trends and changes in attainment status, the National Ambient Air Quality Standards. I work with our local, state, and federal partners to make sure that all of NOACA's transportation plans and programs comply with the Federal Clean Air Act. I do mobile emissions modeling, both for criteria pollutants as well as for greenhouse gases. And I also have been working on estimating the public health effects of air pollution in the region. And then I'm also part of the project team that is currently developing the first regional climate action plan for Northeast Ohio. And so we would definitely welcome any feedback if anyone wants to provide additional thoughts or participate in the discussion around that. I can drop a link to that into the chat.
Thank you so much. We may be joined by another panelist later on, and if they do join us, we'll be sure to introduce them. But thank you all for those introductions. So exciting to have people so close to the work with us tonight. I guess I wanted to start with you, Christina. I was wondering how the city of Cleveland balances concerns about air quality with a desire to attract new industry and businesses to the region. And I have a follow-up question after that, but sort of wondering what mechanisms exist to protect people from poor air quality issues.
Absolutely. So the short, simple answer are air permits. That is the process that we utilize to regulate facility emissions. So essentially, the way it works is that there are a series of regulations that are at the state level. Facilities have to submit applications to us that provide calculations. It provides the exact chemicals, the exact products that they're going to be utilizing. It talks about their process. It might talk about their operation time. So we might receive a facility application where they give us information operating 24/7, 365 days a week. When we receive those calculations and that permit that describes the process, what we have to do is evaluate that and see which one of the Ohio rules might apply. So our staff, we review all that information, write up a permit recommendation, submit that to Ohio EPA, and then Ohio EPA ultimately issues the air permit to that individual. The protections that are in place are based off of the Clean Air Act. And so the Clean Air Act emission standards have a primary focus of public health and then a secondary focus of environmental health. So what we're doing when we're looking at these applications are looking at the standards that are set by US EPA and seeing if Ohio can continue to meet these standards if that facility were to go into operation. And then how do we continue to protect that? We have our enforcement staff. So our enforcement staff are responsible for going to facilities and inspecting them, making sure that they are complying with the terms of that permit, seeing if there are any new emission units, or what we call them, and making sure that they are basically following that permit exactly as it was written. One of the other ways, though, that we extend on that are citizen complaints. So things happen, or there might be a facility that's operating that we're unaware of. So residents are able to submit air quality complaints to us, to our hotline. And this could be anything from strange odors in their neighborhood. It could be strange colors coming from a smokestack, even dust that's produced from construction sites, are all the types of complaints that we would go out and investigate if there is a resident that has an air quality concern.
Thank you so much. That was a really wonderful answer. We did have our last panelist join us, Ivanka Hall from the Northeast Ohio Black Health Coalition. If you wouldn't mind unmuting yourself and introducing yourself to our guest tonight.
Sure. I am so sorry. I was in the store thinking this will be a quick minute. And then the lady in front of me, I don't know what happened. I'm like, okay, yeah. So, so I am here raised home. I am Ivanka Hall. I am the executive director of the Northeast Ohio Black Health Coalition. The Northeast Ohio Black Health Coalition is the first coalition in the state of Ohio to focus exclusively on African American disparities by working to educate, advocate for, and empower the community. We have been around since 2011. I've been doing this work for about 30 years. And I think you just wanted me to introduce myself. So
thank you so much. So if I can actually direct the next question to you, Ivanka, I'm curious about the work that you do around air quality and how you see air quality overlapping with racial justice issues here in Northeast Ohio.
it's funny that you would say that. So, you know, we have communities that are basically under siege. When we look at a lot of the factories that are in our community, where highways are going, the different things that are going on within our urban areas, we have communities that live near toxic areas every single day. Children that are going to school in areas that are very toxic. And so when we're talking about particulate matter, and you know the role that plays around air quality and what happens in those communities, and then where things are dumped, how things are happening within our communities, so much to us without us, and then how much do the communities actually know about the toxins that are there. So I live in the Lee Harbor community. I've lived in this area for 48 years. In about 40 years ago, no, maybe about 30 years ago, we actually had a spill here where one of the businesses was dumping toxins into the water lines, into the sewer lines. And what happened was there were a group of African American women. At the time, you know, people hung up their clothes to dry outside, and they were hanging up their sheets. So they figured out that there were these these black particles on their sheets. And so they would take their clothes back in and rewash them, but they hadn't talked to the other neighbors. So what happens is, before fences, you know, we had open communities. And so the lady started talking and saying, you know, hey, I have these black specks on my sheets every time I wash clothes. And so everybody talked about the same situation, that everyone was having the same thing happen to them. And they reported it to the council person. And so the council person, who, you know, is not an expert on air quality, didn't quite know what was going on. They started doing some investigation and found out that there had been some toxins that were dumped into the sewer lines by one of the businesses. And all of those toxins were coming up from the sewer and then onto their clothes and onto their persons. And so what happened is they made a private deal with these community folks to give them some money, hush money, to not really say anything about what was going on. But what happened is the damage had been done. So all of those women have died of cancer in that community, in my community. And a lot of the other families that lived in the community, they use that money to move only a few miles away. And so one of the things we know about air quality and toxins that are in the air is that a few miles away, you're still in the same neighborhood. And so that means that they moved to what they thought was a safe area that actually was still being impacted by the toxins. And I'm here because my grandfather was also one of those people who was impacted, and he died of cancer in 2003. And so we think about the human capital. What happens to our children when our neighborhoods are contaminated, when our playgrounds are contaminated? What happens when we live close to highways and all the toxins that are coming off of diesel trucks and coming into onto our neighborhoods? And what happens around lead poisoning? That's one of the things I talk about all the time, about the impact around lead, because there is no purpose for lead. So what happens is once it goes up, it comes down and it settles. And so that means that when you start digging, you actually just cause it to just go airborne. And so what happens is we have a lot of homes that the outside of their homes have large quantities of lead, including my own. Like I said, I live in the Lee Harbor community. I live on Harvard. And if you don't know what Harvard is a main street. And so my home was tested for lead, and I have 200 times more lead than I should in my yard. And so what I do is I don't dig in my yard. I make sure that I have flowers and things that can help with the lead. And I put lots of mulch, thousands of dollars of mulch every year onto my area. But when we talk about the impact on the African-American community, we have to talk about the historical impact. We have to talk about what redlining has done to our communities, where toxins landed and why we have more issues on the east side than on the west side. And then what happens to those communities long term. And so that is my piece around air quality and the impact on the African-American community.
Thank you, Ivanka. That's a really powerful story. I'm so sorry for the loss of your family member and for the other women in your community. Truly horrific. If I may ask Almeda to join us and share a little bit about how this sort of local advocacy informs advocacy at the national level at Moms Clean Air Force and beyond.
One of the things that we know is that unfortunately, a lot of people just don't understand the connection between climate change and health. And that is a real barrier. Even though many people, regardless of their demographic background, accept that there's climate change, what we know is that they don't talk about climate change and they don't talk about the impacts. Like, as I was listening to what was just being said, you think about, the advances that we have are in some ways to our detriment because people don't engage in that kind of neighborhood conversation that used to occur, so that you could have someone saying, well, I've got the same problem as you do. There have been a lot of studies done by two organizations in particular, the Yale Climate Communication Center and the George Mason University Center for Climate Communication. And both of those organizations have found that one of the biggest barriers is that we simply don't talk. So Moms Clean Air Force is all about leveraging and communicating and educating at a grassroots level to get moms, dads, and caregivers talking about these issues. That's a start. But we don't stop there because we believe in action, and we know that you don't get action unless you talk to your local elected officials and your local policymakers, and also your federal policymakers and who are making decisions about that affect you and the air that you breathe. A lot of people we find, and there's no magic in what we do except that we make information accessible and we get people to talk, as I said, with their elected officials. And you'd be surprised when you talk with people in your neighborhood, they're stunned that they have the ability to talk to their elected officials. And it's always so disheartening when we find that people are, they're, oh my gosh, we can tell our congressperson, we can tell our US senator, we're having this issue, they could do something about it. Tracy Sabata, who's on this call, is a field coordinator in Ohio and a very effective one. And she has worked a lot with many of the folks here in Ohio. And as I mentioned, we have a very large number of members in Ohio to really, make that difference. It's not a cure-all, but it certainly is an important step. And the other thing that we do is that we work to make information available that is accessible. Most of us are not scientists. Most of us are not physicians or, to have that vocabulary and that background to really understand all of these connections. I mean, sometimes if you say to someone, start talking to them about particulate matter, they may not understand that, but they do understand if you say, there is harmful matter. There's a tailpipe pollution is harmful to your health. It's harmful to your children. More children, especially Black and brown and low wealth income children, have asthma in this country than ever before. It's the largest chronic disease among children. And, for example, if you have a child who's riding the iconic yellow school bus every day and it's a dirty diesel powered fueled bus, that child is being exposed to a cancer causing agent. And sometimes the air inside the bus is worse than the air outside. And I happen to be a mother, my daughter is an adult now, but any of you who've ever been at a school around 3 o'clock and seen all of those cars idling and those buses idling and smelled all of those fumes, it's not good. You may not, but until you may not have thought about it, but you kind of intuitively know this can't be a good situation. So we help people to understand that there is a connection and that we can do something about it. And I just want to mention that in the bipartisan infrastructure law, there was $5 billion, billion with a B, allocated under the Clean School Bus Program to try to bring electric school buses to communities and to remove some of the barriers like infrastructure and working with your local power company and paying for, school buses, which all school buses are expensive, but, it's a barrier if you compound that with many of the neighborhoods that need electric school buses the most don't have many resources. So this program, although it doesn't fund all of the needs, it's a tremendous start to trying to help in all communities, but especially in Black, brown, and low wealth income communities to try to make clean energy school buses available to children, and in turn, that is an impact on their health. So those are the kinds of things that we are engaged in. As I said, we're a grassroots organization and we motivate people to take action.
Absolutely. That is really powerful. And I know firsthand how little agency people feel when it comes to these issues, and they don't realize that a senator or a member of the House, their council person, is just a phone call away. If I can bring it back to Northeast Ohio a little bit, Tim, I would really love to hear your thoughts on how climate change will affect air quality here in Northeast Ohio.
Sure. Thanks for the question. So there's no question that in the aggregate, climate change is going to make the air quality issues that we face in the region worse in a number of ways. There's a little bit of a divergence between the way that it will affect ground level ozone or smog, which is the pollution that we primarily are worried about on hot summer days. When you hear that there's an air quality advisory, that's usually going to be because there's ground level ozone that's formed. And then it'll have different effects on PM 2.5 or fine particulate matter, what Almeda just spoke about. So I'll take each of those in turn. I mean, the first one is that we know that climate change is going to make our region's ongoing trouble with ozone worse. We're already starting to see this. When I look at the data, I can see that around before 2016, air quality continued to improve, or ozone levels continued to drop in tandem with emissions. So ozone's formed by when two pollutants combine in hot and sunny weather. And as those pollutants decreased, NOx and VOCs, we saw ozone levels decrease. That started to change in 2016. And instead what we saw is emissions continued to decrease, but ozone levels flatlined. And we really got a good view of this during 2020 at the height of the pandemic, that we saw a significant drop in emissions, particularly from mobile sources. But even as we saw vehicle pollution fall by up to a third, we did not see a corresponding decrease in ozone. In fact, we actually had more days in 2020 where we exceeded the federal standard for ozone than we did in 2019, despite the reduction in pollution. And there's really no other way of accounting for that other than the fact that the weather was more conducive to ozone formation. And so we're really starting to see that this is becoming an issue that's plaguing our region. Back in 2021, US EPA put out a report where they looked at the environmental justice impacts of climate change across the country. And they specifically looked at how it would affect air quality. And what that EPA report found was that they expect that ozone levels will increase anywhere from 1 to 5 parts per billion on average, most likely towards the higher end of that in the Midwest. That may not sound like a lot, but when you have several days where ozone levels are 1 to 5 parts per billion, just below the federal standard, that can push us into those days where we're putting out advisories and we're telling people that it's actually dangerous for sensitive populations to be breathing the air on this day. And we're that report also found that if we at 2 degrees Celsius of warming, which is the goal of the Paris Agreement is to keep global warming below 2 degrees Celsius. If we were to reach that level, the mortality risk from breathing in ozone pollution would increase 9% for low-income populations in Greater Cleveland. That would increase by 47% for minority populations in the Midwest. So we're really at the front line of the way that climate change is affecting ozone pollution in our region, and it's something that is not going to go away, and it's going to become a bigger and bigger challenge that we're going to be facing over the next several decades, unless we really turn the tide on greenhouse gas emissions. Turning briefly to PM 2.5, that's a little bit more of a mixed picture. That same EPA report estimated that if we had 2 degrees Celsius of warming, we would actually see a reduction in PM 2.5 in the region and a reduction in PM 2.5 related mortality. The reason for that is that we expect in the Great Lakes, there's going to be significantly more heavy rainfall. And when you have rainfall that comes in, it draws the PM 2.5 out of the air and settles it out, and it ends up flowing into our waterways. And so that would have a dampening effect on the pollution. It would actually be a net positive. But if you look at the other scenarios, you see that if we go beyond 2 degrees warming, if we go to 3 degrees Celsius or 4 degrees centigrade, God forbid, we'd actually see an increase in the effects of PM 2.5 in the region and the negative public health effects. So it's a complicated picture. Overall, the signs are not good. It's the air quality benefits associated from climate change are really more than enough reason to address the challenge that we're facing with the climate crisis. Some studies suggest that public health benefits from air pollution alone would be enough to pay for the types of investments that we need to meet our global commitments on climate change. And to just give you a sense of what that looks like, NOAC is in the process of developing a regional climate action plan for Northeast Ohio. It's the first time that we've done that as a region, and we're actually one of the first regions in the country to do this at a regional scale. And as part of that process, we were really focused on the co-benefits of climate action. And I was trying to figure out a way to try to quantify those, at least from an air quality perspective, because that's what I do on a day-to-day, in my daily position. And so I was able to find a study that came out in 2022 and apply that methodology using an EPA model. And what I found is that if we met our net zero goal for emissions for 2050, which is what the region is committed to, we want to achieve net zero emissions by 2050, that we would actually see somewhere on the low end of 277 to on the high end 626 fewer premature deaths each year in the region, and we would reap total public health benefits between $3 and $6.7 billion per year for every year after we reach net zero emissions.
Could I just say one thing, because what he was just saying is so important.
Please.
The EPA is the federal agency that really has the most responsibility for the Clean Air Act, which is our main way of protecting clean air. And right now, the EPA just in the last week announced that they are going to be looking at the 2021 rule, that the proposed rule that they issued, which has been updated, but people just like us, everyone on this call will have an opportunity to submit comments and to say how important it is what happens with that rule. And similarly, right now, the EPA is having accepting public testimony regarding standards relating to methane, which is also a terrible pollutant. But I just want to emphasize, any citizen can submit their comments. And the more that the EPA hears from us, the more they know what we care about and what they should do. And they are more responsive the more they hear from the public. They're always going to hear from, the transportation sector, they're going to hear from, large companies, but it's really important that we as citizens take the opportunity to submit comments to the EPA on these important rules that affect our air quality.
And I think there was a question there in the chat about if you could post a link to the comment period for the EPA, Almeda.
I do not have it right at my fingertips, but Elena, if I could
Email it.
email it to you, then you could distribute it to the people who are on the call.
Yeah. Yes,
Okay,
that'll work.
Thank you.
Mm-hmm. And I really love this exchange between Jake and Tim in the chat. If you wouldn't mind explaining your answer to Jake's question, Tim, which is what is that? O3?
Sure. So there's two different kinds of ozone. So there's what's called stratospheric ozone. That's high up in the atmosphere. That's the ozone layer that protects us from the sun's ultraviolet radiation. That's when you hear that there's a hole in the ozone layer that we're trying to repair. That's good ozone. That's what we want. We want ozone up there because it bounces ultraviolet radiation back into space. The other kind of ozone is tropospheric ozone, which is forms in the lower atmosphere, down where we live, and that's the ozone we don't want. That's where it causes negative health effects by getting into your lungs. And the way it's best described is it gives your lungs a sunburn. And so also EPA to try to put a little spin on it, EPA says ozone is good up high, but bad nearby.
Sorry, I just want to comment on that real quick. I guess the root of my question is is it lighter than the other particles in this atmosphere? Does it rise out of your eventually, or does it just stay here until it gets diffused somewhere else, like in water or something?
Ozone's a very unstable chemical or unstable compound. So in nature, oxygen is a two atom molecule, O2. That's why it's how it's typically formed. Ozone is O3. So you have a third oxygen atom that's attached to that molecule. And so that's really unstable. It doesn't want to stay together. That's actually why it's good in the atmosphere, because it's constantly, that third atom is constantly jumping off and forming new bonds with O2, and that's allowing it to bounce the radiation off. So it degrades quickly in the atmosphere. It doesn't stick around long, and it can only continue forming when there is sunlight present to break the chemical bonds and allow that chemical bond, that chemical reaction to occur. So when the sun sets, ozone formation pretty much stops. So on a day-to-day basis, it just breaks apart on its own.
Yeah. All right. Yeah. I forgot it was unstable, but that makes sense because it's been used for I'm starting to see it used in a few applications for cleaning products as a replacement for other chemicals. So that's just that's clicks for me. But thank you. That's at the end of the day. So
Thank you.
And I know we were just talking about the EPA and the soot rule, which is the particulate matter 2.5. And it's important for us to know that a lot of our agencies, including the Northeast Ohio Black Health Coalition, Earth Justice, were pushing for higher standards, and that the EPA decided that they weren't going for those higher standards. But for us, it's important for us to make sure that we're pushing. And I think that those public comments are particularly important, because what happens is the people who are impacted the most aren't the people that are commenting. So every time I get an opportunity to be at a public comment to make an announcement about how things impact the African American community, which is the community that I serve with the Northeast Ohio Black Health Coalition, I do. And so I was actually just appointed to the National Environmental Justice Advisory Committee. And so I'm sure that they are like sick of me at this point, because I'm like raising hell at every kind of meeting that they put me in. And because I think that one of the things that happens is things need to be challenged. And so what happens is we have these people who are in leadership role, and so it's them and us. And it's not that way. Like, no, it's not us and you, it's the citizens have the power to decide what can happen to them. And I think that that's part of the control that we don't take advantage of. And like I was telling you the story about the ladies earlier, those women have died. But one of the things they did was they formed the Lee Harbor Concerned Citizens Coalition, as a direct result of what was happening to them. They started advocating for change in our community. And so we know that, that these women, who the large majority didn't have a high school diploma, were able to change the things that were happening in their communities. And so us being able to go in front of those and testify, making public comments whenever possible, at all times, whether we're talking about the NEJAC, which is the National Environmental Justice Advisory Committee, or with the WEJAC, which is the White House Environmental Justice Advisory Committee, like going into those meetings and raising some sand. When I was there in Washington a few weeks ago, talking about farm workers, because that's one of the committees that I'm on, and we had people who they had been complaining for 28 years. And so at the end, I'm like, okay, look, if y'all sign me up for this to just take down more stuff about people coming in and saying nothing has been done, no, like, you're going to tell me right now what you're going to do to fix this. Like, what other agencies are involved that can help these people get the solutions that they need? And I think that that's the other thing, is that the reason that, Moms for Climate and all these other groups that we're all out here is because we're seeking to be, and I know it's a cliche, the voice of the voiceless. We have people who do not understand their power. And so we need to make sure that they understand what role they can work in around climate to help change the lives of future generations. Like, for me, I want my grandchildren, and I'm a grandmother, to have a better outcome than me. And so if I'm doing all this work for all of these years and that's not my end goal, then I'm not doing the work right. Something is wrong. And so I think that that should be our outcome for all of us, is that, we may not change this for us, but we're going to make sure we change it for you. So all of those children that are at those schools, that are sitting in those cars or waiting for their parents to come get them, being able to let the parents know, like, this is what's happening while you're sitting out here. Letting the schools know this is what's going on. And I think the more that we're informing and educating the public, the better our outcomes will be.
Thank you. I want to take that really powerful comment and put it back to Christina and Almeda. Christina, if you wouldn't mind responding first, and Ivanka, you might have something to add here again as well, but what does the powerful information that Tim was sharing about the realities of how climate is going to affect people here, how does your organization approach sharing that information with the public? Are you all proactively seeking and advertising forums, and what is your approach to that?
Yeah, so everything that's been raised is a very excellent point. And when we look at the Cleveland community and who's impacted, I believe it was Ivanka that started off the conversation regarding our redlining issue. And if you look at any environmental justice screening tool, the communities that are going to have the worst health outcomes, such as pediatric asthma rates, are within the Cleveland redlining map. So if you look at the environmental justice EJ screening tool, many communities that are in the redline map, they're within the 90 percentile to 96 percentile when it comes to health outcomes and other social determinants. Locally, when you start looking at these maps, you can see an area that follows that's called the Cleveland Crescent. And basically any type of environmental justice issue you would see, any type of social vulnerability issue you would see, falls within that map. One thing that we are looking forward to actually in the coming months is that we are the recipient of a US EPA award to expand our monitoring network. So we will be working on the community leveraged expanded air network in Cleveland, the Clean and Clean project, in which we will be going out to community members and seeking the design method of more air sensors and monitors within that redlined map. And then by collecting this data, this will help us identify where are there specific issues within the within these communities that we have current action that we can take, or that we can propose future action based off of what we're seeing. So the community will have an opportunity to design this network through public forums, through the establishment of a resident advisory committee. And then there's also going to be a series of residential interviews talking to residents about what is actually happening in the community, so that wherever these sensors are placed, they are placed in locations that are representative of resident concerns. And then the data aspect, I think at some point it was mentioned on this call about actually being able to access data and knowing what's going on in your community. This data is not going to just go into a file somewhere. We are also working to establish a dashboard that will have this data available for community members so that they can also take and do with the data, the types of actions that Almeda is talking about and that Ivanka is talking about, and having residents participate in that process. So we are waiting on the final paperwork, but we are in the process of building that program out. And that's one of the areas that we will be focusing on over the next 3 years.
So, at the risk of being a little bit redundant, but one of the things that I'm saying that Momskin Air Force does is that we show up. For example, and EPA has had 3 days of testimony this week on the methane standards. About 70 members, volunteers of Momskin Air Force have testified at those hearings. And what we emphasize, because we're not scientists, we are people who are telling their personal stories of what impacts them and the experiences that they have. For example, because I am involved with focusing on health equity, one of the things that I often testify about, and it's been mentioned by Ivanka, is the disproportionate impact on Black and Brown communities that are often near highways, that are often near chemical plants, and therefore have a poorer air quality to begin with. And it's only exacerbated by some of these other problems that we're seeing. So again, what we do is we have our network of field coordinators. Again, I mentioned Tracy Zapata is the field coordinator here in Ohio, who get moms, dads, caregivers out and who make them aware and get them to testify, help them understand how to testify, give them access to information, and or also get them in front of their local and federal policymakers, elected officials, to let them know how they feel and how they're being impacted. It's pretty, and I think you hear sometimes in our voices, it's pretty frustrating when people just don't have the information, or they don't understand that they can use the information. And I was virtually at that hearing, Ivanka, that you were just mentioning, and it was, at least for me personally, it was heartbreaking to hear someone say that they had been waiting 28 years, that they had multiple members of their families who died from cancer. And, a lot of times, I guess what I am always sensitive to is that some people hear about places like Cancer Alley in Louisiana, and they're familiar with that they may have heard it or seen it on the news, but those are not the places. Like Cancer Alley are not the only places. There are places we've just mentioned here in Cleveland, all over the country, where people are being adversely impacted. And that's what we've got to help people understand. It's not just in one location. There are many locations, and air is something we all breathe. And again, Ivanka mentioned, like, people thought that they could move a few miles away. Moving a few miles away is not going to solve the problem. We've got to solve the problem by taking action and letting people know how people are being impacted and that it has to change.
Thank you.
Amita, you know what? I appreciate you, because so if you sat and watched that testimony, you got a chance to hear me go off. But I think that the other thing too is we have we have these, we have the city and some other folks that are like, we have this grant to do whatever, but the training of the community should have started years ago. Like the young people in school should know this, because we should be in the schools talking with them about it. We can't put the responsibility on the community to come with a plan when they don't even know what they're planning about. Like, we have people who don't know what's going on. And so now we're going to come and say, okay, look, we got a couple dollars and now we want you to help us plan. Plan what? Like, I want to plan a leave, so we have some folks who are who are being poisoned to death. The asthma rates, the cancer rates, all of the other things that are going on in our communities. If these communities that are being disproportionately impacted were white communities, this would have changed yesterday. The education would have been here along with the dollars, not saying we got dollars and so now we have dollars and now we're going to go after you to talk about whatever. It's no, this is a conversation that had needed to start a long time ago. We have some work that had been done here in our community on the sewer line some years ago. And I'm not getting on you, Christina. So don't take it personal. Okay.
I'm good.
I just I call a spade like it is. So the work was being done on the sewer lines, and they put these tubes in the ground, right? And put a blue cap on them all over the community. So the tubes in the ground were for the gases to be able to come up and not to filtrate in an easier manner. And then they had a cap that had openings at the top, right? But they didn't tell the community. So people are going through the community like, yeah, what the heck is going on? Like, these white tubes are everywhere. So if you live in Lee Harbor, you know what I'm talking about. Elena is laughing. But so they didn't tell the community. And it's like, how do you not tell the community? How does the community find out? Like, hey, should we touch those? Should our kids touch them? Do I touch them first and find out what happens afterwards? Like, it should have been an education piece that went along with those. They shouldn't have just been put into the community and nobody knew anything about what was going on and why. And so I think that that's one of the things that happens all the time in the urban community is things get put in our communities, placed in our communities, things happen, and then they're like, oh, we tried to reach out to the community, but no one was receptive to us. And it's like, well, who did you reach out to? Did you reach out to the same people? And then the other thing is that I have to always go back and say, every time I'm in these discussions, is that we have legislators that are legislators because they got the most votes, not because they are the most knowledgeable about a doggone thing. So we have people who got the most votes. And so when we're talking about these things, we have to educate them like we would the community, because they don't necessarily know about any of this and how it's impacting their communities. So when our education happens, it needs to happen within them. We can no longer educate people in a bubble. We have to make sure that legislators understand what's going on in their communities and the detrimental impact. And for me, that's important, because I'm telling you, I have met some people, I've had conversations. I have meetings all the time at my house. Like, if people want to meet with me, come here. So when the legislators come to my house and they're sitting across from me meeting with me, and I'm trying to tell them about the issues that are going on in the community, and they're like trying to look where's the next party at, or who's going to honor me next. Yeah, my thing is I'm honoring my vision as a community. I have a 92-year-old grandmother who lives around the corner. And so for me, I want to make sure that I'm honoring the things that she put in me and that I'm going to our legislators and saying, look, you can't fix what you don't know. So you need to be educated about this also. And so I think that that's one of the things too, that in whatever forms we're in, we have to make sure that we're educating our legislators because they really do not know.
Thank you. And we do have a hard cutoff of 7 this evening. And I'm wondering if there are any questions from the audience. If not, I have something I could pose, but I'll see if there's anyone from the audience that would like to pose something tonight.
This isn't a question so much as just like a little comment. Ivanka, your comment about the voice of the voiceless, I feel like that's so important. You know, I think that for those of us who are aware of these issues, we really have a responsibility to be as loud as possible about it, because there are entire communities that just have no idea. And there's so many like specialties within this, right? Like even just on the environmental justice map, there's like, you know, particulate matter and ozone and all these toxins. And there's so many sources of where they come from. And there's, you know, how you solve each of these problems is not, it requires different specialties, right? So if you have expertise, if you're aware of the problem, like it's definitely on us to like be as loud as possible about it, because there's, you know, several thousand more people that it's impacting that, you know, don't even know where to go for this to, you know, to express their opinion. So just, I want to say like, that's so important. Thank you for sharing that.
Thank you.
And a question for Christina.
Sure.
So I'm wondering, like on certain days, you'll hear on the radio that air pollution, air quality is extra high and you should like put off getting your gas or mowing your lawn. Is there anything in the air permits that would require manufacturers to alter their behaviors during those same timeframes?
No, there are not. So if there's an ozone action day, do manufacturers have to reduce their, change their activities? There is not. I will pose that one of the things that we're working on at the moment is an update to the City of Cleveland Air Pollution Code, which was adopted in 1977. We had started a few years ago in terms of getting some public comment on it. And resuming that work. Our agency was really, we're a public health agency, so COVID-19 really made us refocus our efforts for a couple of years. But at any rate, one of the things that we're working on right now is a revision to that air pollution code so that hopefully this year that will get passed. That is something that has come up in conversation about, are there ways that at the local level, this would just be within the City of Cleveland, can we enact restrictions on ozone action days? So that has come up, but it does not currently exist.
Mm-hmm. Thanks.
Thank you. We had a question from Rhonda in the chat, and I'm wondering if she'd be willing to share it with our panelists.
Yeah, so I'm trying to understand, you know, it's been a lot of conversation around how much poor air quality has disproportionately impacted Black and Brown communities. But as it's been said, that you can't run and hide from poor air quality. So how much of a threat, you know, where are we now? How much of a threat is it to all communities at this point, so that people can begin to understand, like, or stop thinking that this isn't my problem?
Absolutely. I think Tim might be able to expand on the regional perspective and a general perspective there.
Yeah, I mean, overall, air quality has gotten dramatically better over the last several decades. That does not mean that the problem is solved or that we don't face significant public health threats as a region due to air pollution. There was one study that came out a couple of years ago that looked at PM 2.5 because that's the one that has the worst public health effects, and it found that you know, the EPA is talking about tightening the standard that it's had in place for a decade now. But looking at that standard, they found that about between 95 and 99% of the public health effects occur at concentrations below the federal pollution standard. So the standards have dramatically made the problem better, but the health effects are severe and continue to be severe. When I've done some research on this and done some local modeling, I found that we're looking at every year public air pollution is causing between about 640 and 1,400 premature deaths in Northeast Ohio. And it's not just premature deaths. It's creating instances of asthma. It's causing people to have respiratory, health issues. It's causing heart attacks. It's contributing to strokes. It's contributing to the onset of lung cancer and other forms of cancer. It also contributes to negative birth outcomes. So, in Northeast Ohio and Ohio as a whole, we have extremely disproportionately high rates of negative birth outcomes and premature birth, infant mortality rates, maternal mortality rates, and that's particularly the case for Black mothers and Black babies. And what we see is that air pollution actually contributes to that problem. Somewhere on the order of about 5% of infant mortality can be attributed to air pollution directly. So it's a very severe issue. We find that even as there's been multiple studies that have looked at the problem over time, and we see that even as air pollution has gotten better, even as air pollution levels have decreased and air quality has gotten better over the past 40 or 50 years since the advent of the Clean Air Act, the disparity between white communities and communities of color has not shrunk. And so you'll see that somewhere in the neighborhood of in Northeast Ohio, communities of color were exposed to about 15% higher levels of PM 2.5 than white communities. And that level has not really changed over time. So while pollution's going down, the disparity remains. And so that the problem's not going to be addressed through just trying to reduce the emissions as a whole. It needs to be addressed through policies that actually target the communities that are being most directly affected. I will say that at the federal level, the government is starting to work on this. You can see these types of things with the Biden administration's Justice 40 initiative, where they're looking to invest 40% of environmental remediation funds in environmental justice communities. And that's the type of stuff that you need to do to actually focus on the communities that are at the greatest level of harm, or else we'll just continue to recreate the disparities that exist over and over and over.
Rhonda, I want to defer to Tim because he's the expert, but I want to say, maybe I can say this in a more simple term. These adverse impacts affect everyone because we're all under the same sky, basically. But part of the reason why they're worse in Black and brown communities and low wealth communities is because there are other factors that combine with and impact on the poor air quality. So, like the simplest thing is to say, like, if you live in a community where all you have is sidewalks and no trees, it's going to impact you in a worse way. It's going to impact your other neighbors. And if you probably notice every year, the American Lung Association puts out a report and talks about the air quality in different communities and, how bad it is. But it's a combination of factors. It's not usually just one factor. And maybe that might help you to think about why it's worse in some communities, but it is affecting everyone, but to a lesser degree in some other communities.